Parents often ask me this question: if my child takes growth hormone, will they get diabetes later? It's an entirely understandable fear. You want to help your child grow, but you also want to be absolutely sure that you're not causing any harm in the process. Today, I want to address one of the most common and most misunderstood concerns about growth hormone: its connection to blood sugar and diabetes. Hi, I'm Dr. Choi from iGirl channel. Since founding my clinic in 2021, my team and I have supported over 2,500 children in reaching their full growth potential, each with careful, personalized attention to their health and safety. Many parents have heard or read on the internet that growth hormone can raise blood sugar. And that's true, but here's the part that most people don't realize. That's what our own natural growth hormone already does, not just growth hormone shots. Our bodies naturally make growth hormone, adults, kids, everyone. And one of our own growth hormone's natural built-in jobs is to gently raise blood sugar when it drops too low, especially when we are skipping meals or exercising. Think of it as a safety system. When sugar level starts to fall, growth hormone signals the liver to release stored glucose, making sure the brain and the muscles still have enough energy to function normally. So yes, growth hormone raises blood sugar, but that's not a bad thing. It's the body's natural protective function, maintaining stable energy during times of stress or fasting. When a child receives growth hormone treatment, it's not a foreign chemical being added to the body. The medication is basically a clone of the exact same hormone that our bodies already have. That means it also carries all the natural functions of our own growth hormone, including its role in regulating blood sugar. During treatment, these normal effects are simply amplified, not changed. It's like supporting what the body is already doing naturally. Before any growth hormone treatment begins, every child needs to have a thorough screening blood test. If we find any sign of high blood sugar or insulin resistance, treatment is delayed until that issue is fully evaluated and stabilized, because safety always comes first. Once treatment is considered, dosage becomes the next key step. Growth hormone is not something given freely. It's carefully calculated based on a child's age, bone age, puberty stage, and overall health. Each body has its own safety dosage range, and we always stay within it. We never go beyond that range just to make a child grow faster, because growth hormone affects many systems in the body, not just bones. Respecting that balance is what keeps the treatment safe. Think of it as playing an instrument. Too little, it doesn't play. Too much, it will throw the whole system out of harmony. That's why doctors use the lowest effective dose that support healthy growth while keeping the body's natural rhythms intact. As long as the dose stays in that safe range and the treatment is under the close supervision of an experienced physician, there's no reason for blood sugar problems to occur. During treatment, blood sugar is monitored regularly through follow-up blood tests. We also guide families on daily habits that support healthy growth, things like eating balanced meals, limiting excess refined carbs or sugars, and maintaining consistent sleep and exercise routine. Now, let's look at what science says. The best answer comes from long-term research, not online rumors. Large studies that followed children into adulthood show that growth hormone treatment does not increase the risk of diabetes in otherwise healthy kids. In other words, when growth hormone treatment is prescribed appropriately and monitored carefully, the risk of developing diabetes is no higher than the general population. Yes, growth hormone can temporarily raise blood sugar slightly, but this effect ends when the treatment ends. It does not turn into chronic insulin resistance or diabetes. Children who already have certain risk factors, such as obesity, a family history of diabetes, or genetic syndromes like Turner or Prader-Willi, may have a higher chance of blood sugar fluctuation. That's why they need closer monitoring, not because growth hormone causes diabetes, but because they already have a natural predisposition. Most people think growth hormone is just about height, but it's much more than a height hormone. Its effect on blood sugar isn't harmful. It's an adaptive part of how the body grows. With proper dosing and medical supervision, we're not forcing something unnatural. We're supporting a system that already exists. The goal is to work with body's design, not override it. When that balance is maintained, children don't just grow taller, they grow stronger and healthier. So, does growth hormone cause diabetes later in life? For healthy children, no, it does not. Here's what protects them. Careful pre-treatment screening blood tests, precise weight-based dosing within the safe range, ongoing follow-up blood tests, balanced nutrition and physical activity. The key is balance, giving the body what it just needs, never more, and always with respect for how naturally complex growth hormone really is. Parents often worry because they care deeply about doing what's right for their children. And that is exactly the mindset what keeps children safe. Asking questions, understanding the science, and choosing trusted guidance over online speculation. If you found this video helpful, please share it with another parent who might be worrying about the same issue. And don't forget to subscribe for more science-based insights about how to support your child's natural growth. Because when parents are informed, children thrive in height, health, and confidence. Thank you for watching.